The 80-page ADPH toolkit is used for guidance in the Tuscaloosa City Schools to assist the school nurse to determine when a student will need to isolate or quarantine. If we suspect a student of having COVID-19 symptoms, we will need to isolate the student in an isolation area at school until the parent can arrive. If the student has major COVID-19 symptoms, shortness of breath, new cough, new loss of smell or taste, all contacts to the student will be asked to quarantine as well. Close contact is defined as someone who's been closer than 6 feet for greater than 15 minutes, masked or unmasked. This time is cumulative over the previous 48 hours. Isolation keeps someone who is sick with COVID-19 symptoms or has tested positive for COVID-19 away from others. Quarantine keeps someone who is in close contact with a person with major COVID-19 symptoms or has been around someone who has tested positive for COVID-19 away from others. You cannot test out of quarantine. The way we implement the ADPH toolkit is to err on the side of caution to protect the school population. Every situation is specific to that student. Your school nurse will notify you of the amount of time your student will need to quarantine or isolate. Please have updated phone numbers as well as emergency contact numbers noted with the front office at your school. If you are contacted to pick your child up, please do so immediately. Please note that your school will maintain student and staff confidentiality. If your child or anyone in your child's household tests positive, please notify your school nurse. Even if your student is currently virtual, we request that you notify your school nurse if your student is symptomatic, tests positive, or if anyone in the household tests positive. We request this because some of our virtual students may be coming onto campus for various reasons. Safer schools start at home. With the help of our parents, we ask you to check with your student every morning to see how they're feeling. We ask you not to send your child to school if they have any of the following symptoms: shortness of breath, difficulty breathing, new cough, new loss of smell or taste, fever, headache, diarrhea, chills, sore throat, fatigue, body aches, nausea, vomiting, congestion, or a runny nose. Help slow the spread of COVID-19 by avoiding large gatherings, wearing your mask while at school and in the community, as well as notifying your school nurse if your child is symptomatic, or if they test positive, or if anyone in the household was to test positive for COVID-19. If you have any questions, please feel free to contact your school nurse.